Welcome back to day 2 of the Washington Health Data Summit. I'm Joe Gibson. I'm the Senior Data Entrepreneur for the CDC Foundation. I'm excited to be at such a great gathering of so many people who are trying to make public health data modernization happen. And it's great to be here in Washington State, who's been setting a great example on how to make things move. Thanks very much for coming. This morning, I'd like to welcome Janet Baseman, the interim chair. Am I getting this right this time? Thank you. Interim chair and professor, University of Washington School of Public Health and Epidemiology, and Bryant Karras, Chief Medical Informatics Officer at the Washington State Department of Health. Take it away, guys.
Welcome to day 2 of our event. I feel like this should actually be our official welcome because you're experiencing our true Seattle weather this morning. Yesterday was an anomaly, you may have heard. So Bryant and I didn't really coordinate, but I was thinking last night about a reflection that I wanted to make on the word partnership. And I think the word partnership came up hundreds of times yesterday. We talk about public-private partnerships, we talk about public-private academic partnerships, but I think there's a word that's missing from partnership, and it's a part of partnership, but I think it's kind of important to solving big problems, especially when things get out of control in an emergency situation. And that word is trust. And because during the blue sky times that Dr. Shaw was referring to yesterday, it is true that it is absolutely critical to be forming partnerships and better infrastructure during blue sky times. And you can create transactional partnerships. That's important because they need to work for all of the partnering organizations, and understanding the drivers and motivators of these different partnering organizations is essential to success. But you can have a partnership with trust, and you can have a partnership without trust. And I think when things start to destabilize, just like in any relationship where your relationship with a person is tested most during times of stress, you really understand whether you have a trusted partnership or just a transactional partnership. Okay, so this may just sound like words, and I'm not an organizational psychologist, and so there are probably people who could speak much more intelligently about this than I can. But I do have some on-the-ground experience, and I want to tell you all a little story. So I'm an epidemiologist. I spent a very long time in schools of public health getting trained to be an epidemiologist. And then I knew that there was something missing from my training because I'd really only been trained to write papers and grants and not to actually do anything, real and applied with the work I was doing. And so I wanted to do some applied work, and I was very fortunate to get a postdoc position in which I was able to split my time between a local public health department and the University of Washington. And I learned from the lovely and talented Scott Lindquist, who many of you know as the Washington State communicable disease epidemiologist. But at the time, he was the health officer in Kitsap County, Washington. So for 3 years, I split my time between Kitsap County and the UW, and I could not believe that I had been in public health school for so long, but really didn't know what went on in an actual public health department. So I left that position. I was at a crossroads. I decided to go the academic route, and I decided that I was going to make an attempt to have my students understand what applied epidemiology in a public health department was, the kind of experience that I didn't have when I was a student. So I came up with this idea to create a student outbreak response team where, I would have my students go out and help state and local public health agencies during their times of need. And I thought this was a great idea because it made sense transactionally, right? My students were going to get the experience that I felt like they needed in order to be making decisions about their future careers. And then the health departments were going to get the benefit of surge capacity support during times of need. So it took many years just within the university for this to, kind of be able to move forward, which happens. It's not an important part of this story. That's a different story. So I went to leadership at the Washington State Department of Health because clearly I needed buy-in and partnership with the health departments in order to make this happen. And state partners were like, let's give it a try. But before kind of rolling it out, I called a friend of mine at Public Health Seattle, King County. Is Sarkis here today from King County? Not yet? Okay, he was here yesterday. So I called a friend of mine at King County, and I said, I have this great idea. I want to tell you about it, and I want you to tell me what you think about it. And here's what she said to me. She said, Janet, when we are in the middle of an emergency, an incident command, the last thing we need is your students running around the health department. Now, when you tell that to a professor who loves students, like it's a little, it's a little heartbreaking. And I will never forget that she said this to me because I was like, oh my God, like I can't just create a team, I actually have to train them and prepare them to be useful in the health department during an emergency. Okay, so I think there are other student outbreak response teams at other universities in the country, but I think we might have created the first one where we actually wouldn't let the students go out until they had taken a class and how to be prepared to be useful. So in 2015, we rolled out this program. There are actually several people in the room who were part of that program, Eliza, Adam, some other folks. And it was great. We helped with Zika response, we helped with foodborne outbreaks, we helped when there were surveillance system, changes. But then COVID hit. And we had this infrastructure in place, which was great. But I didn't know how much of a trusted partner I was. Like, I knew things were working the way we had built the program to work. So, as you heard yesterday, and all of you know, we had the first case here in Washington, and things just kind of slowly, if you remember the slow roll, kind of like falling off the cliff feeling, those of you in public health know what I'm talking about, as like things were just kind of like mounting and mounting and mounting. And I was getting calls from DOH colleagues, like, can you guys come out to help, you and the student team? And I reached out to Jeff Duchim, who was the health officer in King County, on a Saturday, and I said, hey man, I know things are crazy, do you guys need some help? And he responded and brought a bunch of his team onto the thread and say, hey team, do we need some help, from the University of Washington? And then one of his people chimed in and said, can you be here on Monday? So this is Saturday. Can you be here on Monday, like with a team? And we did it. We were able to do it because we had infrastructure in place that we had built years earlier in order to be present. What happened after that was like a crazy proliferation way beyond the capacity of the student team that I had built. And
Sarkis just came in.
I was just talking about you, Sarkis. I'll tell you later. And the health departments were saying we need more, what can you do? It wasn't just King County, it was the state as well. And I said, what do you need? And they said, we need this. And so I created a survey. I sent it out to the entire School of Public Health and all of their peripheral folks, thousands of people. We had over 1,000 responses to this survey saying, here are my skills and here's how I can help. We ended up deploying on a rolling, around-the-clock, 7-day-a-week basis for a short period of time early in the surge to King County in order to assist. And I'm going to stop the story there, although there are a lot more components, and if you're interested, and I can tell you some of the details later. But I don't believe I would have been called upon to assist in that way with my students had we not had A, the infrastructure in place already before the emergency, and B, had the trust of these organizations. And the just last point I'll make before turning it over to you, Bryant, for some reflections are that number one, if you are in a state that does not have a relationship with your university or school of public health and does not have this type of infrastructure in place, you're missing out on something, and I would love to talk to you about how to make those connections with your universities. Number two, if you are a federal person, I would like for you, when you talk about public-private partnerships, to not forget the academic role. There are universities like mine all across this country with a ton of expertise and resources, people who like to do good and want to help. I'll ask you later, Chris, why you're laughing. But it's a resource. And I think academic schools of public health across this country, we may be very good at it here in Washington, but I think there's great potential across the country as well. Thank you.
Thanks, Janice. So, thank you everybody for coming back today, surviving the heat of yesterday, and welcome again to the Pacific Northwest and the lands of the Coast Salish people. One of the things that I wanted to point out first and foremost is that you may notice in the agenda that we did at the end of conclusion of today, 3 o'clock, we're encouraging people to attend the Burke Museum, which is just 2 blocks away on the corner of 15th and 45th. And the Burke Museum is not a museum of dead cultures. It is a living museum that's a natural history of the Pacific Northwest. It had I believe, the largest collection of Native American, Alaskan Native, and First Peoples artifacts in the country until they repatriated and gave almost half their collection back to the people that they had been collected from. So now I think the Smithsonian has the largest collection. It's an amazing living museum that's used and engaged with by the people of the Pacific Northwest. The first floor is indigenous art and artifacts. The second floor is natural history of species that inhabit this area, and the third floor I think is the coolest, and or at least when I had little kids was always the coolest, is dinosaurs and mammoths. And it's a fascinating way to understand historically and currently what this region is all about. So I really encourage you to take some time before you leave Seattle to make a visit. It says in the agenda that we had negotiated a 15% discount for all of you. I checked in with them last night and told them what we were working on over here, and they're like, oh, that seems really important. How's a 50% discount sound? So so half off if you go there at 3 o'clock and show your CDC Foundation badge. Of course, recycle the plastic part of the badge with the folks as you exit, but keep that paper part so you can get a discount when you go over to the museum. I will be walking over there so that you don't get lost, wearing the vest so you can spot me. But I hope some of you are able to join us. I do want to, seen a lot of old friends these last few days, and some folks that I haven't seen in more than a decade, reconnecting with in person for the first time in a long time. I wanted to reflect a little bit on, well, first of all, acknowledge the amazing partnership with the University of Washington. I think we wouldn't be here where we are today if not for the work we do together. And something that I think was solidified, and I was surprised you didn't mention this, we actually created a charter, not before you established those relationships, but as they were moving on, and this was before the pandemic hit, I think actually just before the pandemic hit, we developed a charter between the university and the Department of Health to be a academic public health department, that we were dedicated to working scientifically and learning and growing from each other, participating in a way that we can continue to evolve. And I think you're seeing some of the results of that our health department continues to innovate and grow. All right, they're signaling I'm out of time, but I am going to say one last thing before I bring up, but if the other panelists could get ready to come up and join us. This hotel also has some special historic meaning for me. when I was faculty at the UW, full faculty before I joined the Department of Health, I was asked by the CDC to convene experts from around the country and author the first public health informatics competencies for what you needed to know and do to be an informatician. It's a historic document now. When I look back at it, it had things like know how to use email. You think I'm joking. This was early 2000s, and like there were health departments that didn't have email, or they had one email for the whole department. So we really have evolved from those early competencies, but I had to struggle to recruit 12 to 15 people from around the country to come to Seattle, and we met in this hotel in one of the small conference rooms on the second floor, and over a 3-day period authored the competencies using a Delphi method, so we were all in agreement. Finding 12 experts in public health informatics was a challenge in the early 2000s. For this meeting, I apologize to those of you who we had to do this, I had to say no to so many people when they said, oh, we're coming to your conference, can I bring 3 colleagues? We're coming to your conference, can I bring so-and-so and so-and-so? There were so many people who are active in this domain now. The energy, the interests, the maturity that we have 20 years later is so heartwarming. I think we've grown, and I'm so looking forward to what happens in the next 20 years.